publication of the Bussola Institute research paper, the COVID-19 outbreak, implications for relations between Europe and the Gulf. As you are all only too aware, we are living currently in very uncertain and challenging times. COVID-19 has turned our world as we knew it completely upside down. It has shattered many convictions, upended many projects, plunged many countries into deep economic recession, and made the unthinkable a reality. We are currently facing a global health crisis of massive proportions that is affecting all segments of society. And this fugitive virus is killing people, spreading human suffering, and irretrievably changing people's lives. We have become ever more aware of our mortality, as well over 400,000 people now have died of a disease that nobody even knew existed just a short 6 months ago. This dangerous and elusive virus still lingers as a very real threat, and fear of contracting it continues to grip many in society across the world. The crisis is universal. Normal healthcare is wounded. Millions of people are losing their jobs. Businesses are being wiped out, and many economies are in shambles. During our webinar today, we will explore some aspects of how we need to try to learn to live with, cope, and manage COVID-19, and not just hide from it. To do this, we will look at some countries and people across the globe who have discovered their fragility in recent years, and their reliance also or in recent months, and their reliance on the rest of the world. We will explore the importance of international cooperation and partnerships, and opportunities for the development of more structured economic ties between countries and regions. As many of you will be aware, the mission of the Bussola Institute is to generate and share information and knowledge that fosters improved understanding and promotes stronger Gulf-European relations. So this has become our particular focus today, and therefore we will address the pivotal role of both the European Union and the Gulf Cooperation Council in promoting human solidarity and global cooperation in addressing the many dimensions of the crisis created by the pandemic, and how, working together, they can further leverage their relationship to play a more active part in driving the global response to the COVID-19 pandemic. In the middle of a crisis, it can be very hard to focus on anything but the present. However, eventually our focus must shift to the future. We now know that the COVID-19 outbreak affects all segments of the population, but it is much, much more than a health crisis. COVID is impacting enormously on economies, people, societies, and cultures. And it is envisaged that the pressures of the pandemic on future social and workplace engagement will be enormous. For the foreseeable future, issues relating to social distancing, the future provision of healthcare, the present and future delivery of education to our young people, combined with the rebuilding of economies, will change in a very fundamental way how we as people will live and interact with one another. For months, governments have effectively frozen social and economic activity in their attempts to contain the outbreak. Billions of people worldwide remain under some type of lockdown. Many countries have now tentatively begun to reopen their economies, but unfortunately, new outbreaks have caused some countries to reimpose restraints. It is worth noting that the Bussola COVID-19 report was written in the early stages of the pandemic. Yet it flagged, among others, the issues of the economic consequences, the uncertain future for international cooperation, the strain on European solidarity, and the possible worsening of the conflicts in the Middle East. To exit lockdowns and restart economies, there needs to be a clearly understood roadmap, and people across the world need to feel that it is safe for them to return to what is now being called the new normal. We cannot afford to get this wrong. Any attempt to restart economies and reopen our countries depends on a robust system of containment measures to limit transmission and exposure. It also depends on developing exit strategies which will protect lives and livelihoods. Reopening must be carefully planned and implemented. It shouldn't and cannot simply result in returning to what we were doing before the pandemic. During today's webinar, we will discuss how EU and GCC countries can learn from and support one another during this highly critical exit phase. The Bussola report suggests that as we grapple with the current environment and prepare for what is potentially to come, Europe and the GCC should explore the framework for a common agenda, in particular as far as health issues are concerned. The Bussola report indicates that the longer the crisis lasts and the longer the obstacles to the free flow of people, goods and capital are in place, the more the movement towards self-sufficiency and away from globalization could take hold. While globalization will not disappear or be discontinued as a result of the implications of COVID-19, the Bussola report puts forward the view that economic and social patterns will undergo a transition to more regionally based models of cooperation and interdependence. Of most significance to our discussions today, the report highlights the fact that Europe and the GCC are already well positioned in this matter, given that they already have well-functioning regional organizations that they can tap into. Finally, it is clear that if they work more closely together, the EU and GCC are ideally positioned to take up a leading role in the world of politics in the post-coronavirus era. These are possible topics for exploration in our conversation today, and we are very privileged and grateful to have three distinguished and esteemed speakers, one of them our own, and two very special guests. I would like in particular to welcome three people who will join me on this. Dr. Christian Koch, who is our Senior Advisor and Director of Research, Ms. Hoda Al-Halassi, and Mr. Barry Andrews. And I will introduce each one in turn as they are about to speak. I've asked each panelist to share with us their personal thoughts, their insights, their perceptions, and their reflections on the impact of COVID-19 on individuals and on societies across the world. And to set the scene, I will ask Christian to begin. Christian, as I said, is our Senior Advisor and Acting Head of Research, or Director of Research at the Bussola Institute. Prior to joining Bussola, Christian served as Director of the Gulf Research Center Foundation. And indeed, he has worked at in a lot of different roles down through the years. Much of his work over the years combines the analysis of the Gulf Cooperation Council states on pertinent foreign and security issues, with a particular interest in GCC-EU relations. And as Christian was the author of our COVID report, I now ask Christian to speak to us. So over to you, Christian.
Thank you very much, John. Thank you for that introduction. And it's a pleasure to be joining everybody in today's webinar. And hello to everybody out there who has joined us. I'm glad we have a large number of people already listening in. I want to just sort of pick on a few observations that we highlighted in the paper. As John already rightly pointed out, the paper was written and published in the middle of April, so it was still quite at the early stages of the pandemic. But we wanted to see draw some, what we felt were some early lessons and early indications that we could draw from the crisis and draw from the pandemic, and to see how this will impact on the relationship between the EU and the GCC and the Gulf and Europe in general, since that's very much the focus of the Bussola Institute. Of course, you can. The paper is available through our website, so please feel free to download it and have a look at it in more detail. But just a few observations that I think I might want to throw out, and then of course we can have a further discussion on that as we go along. In terms of both Europe and the Gulf region, there certainly were two regions that were hit quite early on following the outbreak of the pandemic in China. We saw in the Middle East that Iran was severely impacted and became a first epicenter after China in the region. And in that way, it also swapped over to the GCC states. So the Gulf was an early region that felt the impact. And similar, Europe was also, with Italy being one of the first countries quite early hit. Now, some of the assessments we can draw from the reactions that we saw early on in the crisis is, I think that certainly early and strong decisive decision-making helped to kind of ease along and help with dealing with some of the consequences of the pandemic. I think in the Gulf and the GCC states, we saw some very early reaction. In Saudi Arabia, authorities closed off the pilgrimage, the Umrah, at the end of February already, and limited access. There were big decisions being taken in the Gulf. There were total curfews being implemented in Kuwait, later on in Saudi Arabia, in the UAE as well, in other GCC states. Travel restrictions were imposed quite quickly in terms of limiting flights in and out of the country and even stopping all kinds of travel to happen. So I think in these instances, what we see is that if governments were able to take and willing to take, even if it was tough, but decisive action quite early, that helped in sort of limiting some of the spread of the pandemic. I think another lesson to sort of be learned is that the investment that countries make in their healthcare system certainly paid off in a way. Again, in the GCC, we've seen over the past decades quite a strong investment into the healthcare systems of the region. So we do have modern healthcare systems, and these were able to cope with much of the impact of the pandemic. In Europe, we see it also in cases, for example, as in Germany, as well as in Ireland, where there's been sort of a strong investment in healthcare, and Germany has one of the highest emergency room bedding per capita in the world. Germany was able to cope much more with the pandemic than other countries where there had actually been some cuts in healthcare. So I think, again, this is the importance of proper investment in some of the response mechanisms that have helped as well. I think trust in government is a key. And I think we see this also again in both areas. Where those trust exists, people tend to follow the regulations and are willing to go along and accept some of the decisions being put forward, even though it's a severe curtailment also, of course, of personal freedoms and of all our independence. And where that trust is low, then some of these instructions are not followed as strictly and are often ignored. And that, of course, leads then to more difficult cases. So again, I think in the GCC, we've seen that the trust in government is fairly high. The GCC governments have applied quite good and effective communication strategies in terms of highlighting the costs of the epidemic and its potential consequences. And I think that has quite helped a little bit. I mean, infection numbers are still large, but again, there's been a responsive mechanism in place. And I think this is something that now where also the Gulf and Europe can join together and sort of applying for lessons learned from the pandemic, and how you can move forward to implement some forward-looking lessons. I also think that, again, even in the Gulf, there's a readiness to impose severe measures again, if that needed to be the case. And we've just seen that recently with Jeddah being imposed again for a weekly curfew. And Abu Dhabi itself has also imposed a lockdown on the city as quite a number of testing goes on. So I think these are important lessons to be learned. For both the GCC and the EU, economies are also, of course, impacted quite severely. That's because they are both quite integrated economies with deep linkages into the global supply chains. Now, the GCC has been impacted basically by a double whammy, because at the same time that the COVID pandemic has hit, we also saw the collapse of oil prices, mainly due to two reasons. One is the already oversupply in the global markets. So prices had already been fairly low as compared to recent years. In addition to that, of course, we've seen the tremendous demand drop in countries like Asia, regions like Asia, where a lot of the exports from the Gulf also go to in terms of oil. So this combination has led to a complete collapse in the oil price, which has hit the GCC countries quite extensively, because since their economies still depend a lot on the price of oil. At the same time, I think that there is some resilience in both the Gulf and the European economies. We see that in the various stimulus responses that have been put forward. And that is a little bit of a positive note in terms of that there are these economies that can actually still cope. GCC economies are quite high income economies. Here the governments are also able to respond to some of the most immediate impacts. Now, if we take a sort of a step back and look a little bit at the broader picture, we see a couple of other implications that are worthwhile exploring. On the economic impact, of course, the regions are able to cope at certain stages, but one has to be quite honest and say that the global economy is not in the best shape. I think there are still some repercussions left over from the 2008-2009 financial crisis, that some of the regulatory measures have not all been implemented. We see global debt levels being still quite high. And of course, recent decisions to hike spending by a lot of governments will add to those debt levels. We also see the world trade system not being in the best shape, with increasing disputes, for example, between the United States and China on trade. Now, all that is also, of course, going to impact. And then we have to see where priorities will lie as a result of this crisis. In the European case, you know, we had the new commission come in at the end of 2019 with an emphasis on a new Green Deal strategy and on digitization. That there are some suggestions now that some of that might be pushed back a little bit in terms of the priorities because of the COVID epidemics and the need to restart economies. So I think that'll be interesting to see what happens. In terms of the Middle East, we of course have the situation of still a number of unresolved conflicts in the region. Now those situations are not necessarily getting any better because countries that are involved in conflict will have a much tougher time and dealing with the COVID implications. The same thing is there will be a little bit less availability of humanitarian development assistance possibly, as countries are coping with their own situations and might not be as ready to provide needed assistance in some of these conflict situations. And the unresolved conflicts in the Middle East are also suffering a little bit in terms of these questions that John already mentioned about the future of the international cooperation. It's very much in doubt. We don't really see clear international leadership at the moment. I think the Chinese position is still quite opaque, and we have to watch that carefully. The US would appear to have at least substantially withdrawn from international responsibility. The decision to step out of the WHO is just one example. Now, for the EU and the GCC, what does that mean? Well, I think both sides don't necessarily want to be caught up in having to choose between either Chinese model or a US-led international community. So it becomes sort of, how do you reevaluate some of those positions, and what does that mean for coordination? Just two final comments. A little bit more positive on the regional outlook and regional integration. I tend to be not as pessimistic. Yes, European solidarity has been questioned quite a bit, but I do think that Europe has caught itself in a way from the initial first weeks of the pandemic, has shown a high degree of solidarity. And my sense overall is that the countries inside the EU are quite glad that they're inside and not necessarily outside. It's definitely, it's sort of a better to be inside the club than being outside, because you can draw on the various institutional mechanisms around to support also in terms of build-up. Same thing on the GCC level. The GCC has been in a crisis for quite some time, and there's little indication at the moment that some of the issues are going to be resolved. But at the same time, the institution still functions. And we've seen health ministers meet among all the 6 countries. We've seen a food security strategy being agreed to. And I think that's also a positive response. So that's a little bit more of a hopeful note. Finally, in terms of the EU relationship, I think definitely there are opportunities that we need to explore further. A framework exists, so that's positive. We have an EU-GCC cooperation agreement. We have relations both at the bilateral and multilateral level. So if we can consider to definitely expand into the health issues, again, a common strategy on lessons learned, also how to prevent a second wave when and if that happens. I think an expanded economic dialogue, especially as both sides, again, are coping with the consequences and looking maybe even towards opening FTA, free trade area negotiations between the two sides. And finally, coordination also to find solutions for the conflicts in the Middle East. Expand dialogue mechanisms overall. We've also already seen some calls for de-escalation coming out of the Gulf. The UAE in particular has been in the forefront. Kuwait, Qatar, UAE have provided humanitarian assistance to Iran. I think all that is an opening that we need to sort of follow further. And I think that gives us a little bit of an optimistic note that we can tackle some of these shared challenges. I'll leave it at that. Sorry, I went a little bit over my 10 minutes.
Thank you very much, Christian. No problem at all. It was interesting and worthwhile. Our next speaker will be Hoda Al-Helassi, and Hoda is a good friend of ours at Bussola. She came to one of our forums last June in Brussels, and she was remarkable in the way that she performed at that. It was fantastic. So we've kept in touch with Hoda, and just for those of you who have joined us today, Hoda is a member of the Shura Council of the Kingdom of Saudi Arabia, and her background, believe it or not, is in French and English language and literature, and she was a university lecturer for many years in those areas, both in French and in English, and indeed has been working for many years with the Bureau of Experts Translation Division at the Council of Ministers in the Kingdom of Saudi Arabia. She, as I mentioned, she's a member of Shura Council, and she was honored, especially in the year 2013, as one of the first 30 women to join the Shura Council. I think the number has grown now, Hoda, to around 150, if I can remember rightly. It has certainly grown. And Hoda has continued to remain a member of the Shura Council. And indeed, since she joined the Shura Council, she has also been a member of their Foreign Affairs Committee. And also, she's a member of the IPU, the Interparliamentary Union, and represents Arab women on in that forum. So I'll hand over to you, Hoda, and I am so glad that you decided and that you agreed to come along to it with us today.
First of all, thank you so very much, John, for this introduction. It sounds like you're talking about somebody else. Just a quick note, the Shura Council has 150 members, even prior to women joining in. It started with 60 members and has moved on to 150. But yes, it has been an honor to serve at the Shura Council. Thank you very much for inviting me to participate. I will take about maybe 10 and a half, 11 minutes, if you don't mind.
No problem, no problem.
Thank you. So,
We'll be finishing at 1, but there's no problem. We can shorten the number of questions. This is
okay,
great.
okay. So no doubt about it, life as we know it, as you have said, has completely changed. The world as we once knew it has been transformed. We are living one of those historical moments history books will write about forever, not so much because COVID-19 is a fast-spreading pandemic, but because it is taking an unidentifiable direction, heading to a place unknown. It is unpredictable and so far untreatable. It is a disease that is quote unquote egalitarian in that it doesn't differentiate between young and old or rich and poor. It has also brought to the surface flaws in governance and healthcare systems, as well as social, political, and economic problems. Our mission then is to learn from this experience and rebuild a new normal with as few of the global difficulties we have seen so far in the first half of 2020, because simply said, there will likely be a replay of the past few months, and whether or not the virus mutates, becomes more or less severe, is yet to be seen. As of today, and not unlike other countries, Saudi Arabia's numbers have increased and reached 105,000 confirmed cases with 746 deaths. Our numbers were comparatively small from February to mid-April when it went over the 1,000 mark, and the trend kept rising, reaching a peak of 2,840 confirmed cases on the 16th of May. The last 2 weeks of May saw a downwards trend as stringent isolation measures were implemented, especially during the 4 or 5 days of Eid, which celebrates the end of Ramadan, when no one was allowed to leave their homes. End of May, beginning of June saw a tentative attempt to slowly return to a somewhat normal life. Perhaps it was too soon, as today our numbers are the highest we have seen since the beginning of the pandemic, to the extent that the city of Jeddah had to be put in lockdown once again, with the possibility of Riyadh and other cities following suit. The government of Saudi Arabia took early action and learned from the disastrous outcomes that took place in Europe as the epicenter of the disease. It has implemented protocols from the very beginning of the corona pandemic that were to benefit Saudis and non-Saudis alike, including undocumented foreign workers. The measures have been efficient and practical. They have included curfews and complete lockdown in certain cities. With the exception of pharmacies, hospitals, and supermarkets, everything closed down. Why did Europe become an example? Simply because the pandemic reached our region several weeks after Europe, giving us ample time to observe the effects and impact of the different decisions taken by European governments, the EU, and the WHO. And because this disastrous situation has no precedents, no one really knows the best way to deal with it, or indeed how to eradicate it. In addition, Saudi Arabia has had years of experience with the Hajj pilgrimage, which requires the adoption of stringent measures when dealing with large numbers of people, not just from a health point of view, but also from the point of view of security. We also benefited from the knowledge that was acquired in 2012 during the MERS outbreak, and therefore the decision made by the Minister of Health incorporated all these elements. Measures taken include schools, universities, and national and international flights being suspended, as well as public transport. The Umrah has been deferred to be resumed only when things improve, and the Hajj is still under review. Mosques were told to stop public prayers and have only started once more in the last few days, with certain restrictions put in place. A 2-week quarantine period has become mandatory on anyone coming from abroad or suspected to be infected, and strict social distancing guidelines have been propagated by media outlets. Public employees have been asked to remain at home, working virtually and being paid regularly. Fines are imposed on those who don't abide by the rules or wear a mask, even when driving. Hospitals and hotels have been put at the disposal of the government, and all expenses to lodge and feed people are laid at the government's doorstep, including hotels abroad, which have been used to house students and citizens making their way back to the kingdom. Children under the age of 15 have been forbidden from going to commercial buildings, and public mixing has been prohibited. A maximum of 2 people only is allowed in car, and only for convincing reasons. Additionally, testing of the general public is done randomly, especially in areas where the disease is rampant. Banknotes are not to be used as much as possible, a bank card being the safer payment method. Toll-free numbers have been put in place from the very beginning, and free testing for all has been made available to anyone who may have caught the virus. All possible procedures and financial expenses have been taken to ensure the well-being and health of citizens and residents. The government has also given extensions on renewals of insurance policies, IDs, residence permits, and re-entry visas. These measures are ongoing, with the exception of the 2-week hotel quarantine for all, and new ones are regularly introduced. For instance, people suspected of having corona are now requested to remain completely isolated at home and asked to wear a smart bracelet to confirm that they do so, or else incur a fine. Last but not least, drive-through pharmacies and clinics are on the increase and have helped diminish the risk of transmission and ensure social distancing. As elsewhere in the world, we have learned to use technology in a more comprehensive and relevant way, whether for work purposes, for connecting with loved ones, or online shopping during the lockdown. We are lucky and grateful that our infrastructure is sufficiently solid and capable of supporting our needs. From an economic point of view, the government has addressed the negative impact Corona's lockdown has had by pledging large sums of money to small and medium-sized enterprises and paying up to 60% of their employees' salaries. Many businesses, restaurants, tourist facilities, hospitality and retail have felt the domino effect of the virus and have suffered accordingly under the financial burden it has engendered. Many have had to close or cut down. Unemployment has been a problem prior to the pandemic and has rapidly grown, as in other countries. And the challenge for today and tomorrow is to resolve it as much as possible, as fast as possible. If Saudi Arabia had not acted so fast and so firmly, I truly doubt that the numbers we would have had would be anywhere as low as the ones we have today, especially with regards to fatalities. And yet the numbers are on the rise. And that is due on the one hand to the fact that there has been a loosening of the lockdown measures, and on the other to the fact that we have had extensive testing, which compared to some of the countries in the MENA region, which have not or cannot test extensively, have brought the numbers to a more realistic level. We still have to ask ourselves a question that has divided people everywhere, simply because the answer doesn't really exist yet. In view of the fact that no cure is available at this time, is the option we have chosen, i.e. isolation, the right one, or is it more damaging than the disease? I personally support isolation and distancing, but I also see how damaging this is for the economies of the world. Overall, I believe the kingdom has played its cards well. And yet I feel that just like many other subjects concerning Saudi Arabia, people are quick to criticize and judge without doing their homework. Take Science magazine, for example, a well-reputed and respected weekly magazine read by an intelligent and highly educated audience. It published a paper last month on the effects of COVID-19 on the most vulnerable population, in which the author stated that, quote unquote, many foreigners are being summarily expelled, such as India and Saudi Arabia. Now, for the record, Saudi Arabia has taken care of all residents in its territory, regardless of nationality, social or legal status, giving everyone equal attention and the best healthcare possible. Information in a magazine such as this one, and in fact in any self-respecting platform, has moral consequences. The kingdom is on a learning curve, as is the rest of the world, learning about what matters, about re-evaluation, and about priorities. Corona has disrupted the internal mechanism of the world and has created a disequilibrium that requires many questions to be answered and an honest evaluation of the true cost to governments and societies, starting with the core of all societies, public services, which have been placed under exceptional strain. We are learning the true value of a healthcare system which needs proper attention and budgeting as well as adequate staffing. Today, Saudi Arabia's health workforce stands at approximately 1 per 80 persons. Good, but can be better, especially as our population is on the rise. We are also learning that one of the ways a strong healthcare system can be implemented is by following WHO's 6 building blocks. Other issues need to be discussed as a result of this pandemic, mostly political in nature. We are likely to be at the dawn of the end of globalization, which will be replaced by a new system, one in which we look inwards within our nations and become more self-reliant in the possibility of insulating our economies. How effective will that be? And yet, multilateral relationships will always be crucial when dealing with possible future problems that may affect the whole world. Will this crisis engender more populist and nationalistic movements globally, possibly leading to more xenophobia, more racist activities, or even more terrorist acts as poverty, unemployment, and inequalities increase? One certainty out of this disaster is that we need to learn to work more and better together. We need to create preventative measures to minimize a global health crisis. We need transparency between nations in order to protect humanity, predict and avoid any future pandemics, and be prepared for such emergencies. COVID-19 has shown us that we as nations are on different chapters of the same page, each choosing a road, some starting faster than others, some delaying measures, others opting for herd immunity, and others opacity. And although I'm not implying that we should all follow one protocol, I am, however, advocating for more common cooperation and action, which are keys to predicting, preventing, and containing disasters. Thank you.
Thank you very much, Hoda. That was wonderful, and it's so good to have you with us and to get your views. And we really wanted to understand from a GCC perspective. And I have one or two questions for you afterwards. Maybe looking from the GCC at Europe.
Okay.
Our next and our final guest this morning is Barry Andrews. Barry is a member of the European Parliament. He's a very highly experienced and highly respected Irish politician who, prior to his election to the European Parliament, was Director General of the prestigious Dublin-based Institute of International and European Affairs, the IIEA, which is generally regarded as Ireland's leading think tank. So I'm hoping we can forge a good relationship with Barry into the future, as we'll both be mixing and from time to time in Brussels. Prior to his appointment to the IIEA, Barry was Chief Executive of the Irish aid charity Goal, which indeed I think would give him great insights into much of what's happening across the world at the moment. He also served as Minister for Children in the Irish government and was a member of the Irish Parliament from 2002 to 2011. Hand over to you now, Barry, and thank you so much for agreeing to join us. He's also serving, incidentally, as a member of the European Parliament and on several committees from Dublin at the moment on lockdown. So
thank you, John. That's great. Thank you for that introduction, John, and good afternoon to everybody. Really honoured to join this distinguished panel for this opportunity to really discuss about the impact of COVID. And it really, John mentioned my background in development, and when I was head of the International Aid Organization, GOAL, in 2014-2015, we led a very large-scale response to the Ebola outbreak. And it is tempting to draw analogies now with what happened in 2014-2015. But I think it's important to remember the scale of what's happening now is completely different to what happened in West Africa. If you remember, there were merely just under 30,000 confirmed cases of Ebola virus in West Africa over a 9-month period. And I won't say just 10,000 deaths, but when you compare it to 400,000 deaths that Christian mentioned at the top of this discussion, it just puts it in some kind of perspective. But I think the one thing that we need to consider when we're talking about cooperation and health system strengthening for the future is what happens when a virus comes along, maybe a zoonotic virus that comes from the animal kingdom, that is as lethal as Ebola and is as transmissible as COVID. So that's the real worry I have. And as we talk about cooperation for health systems, I think that's the nightmare catastrophe situation that we really need to have in mind. As regards the current situation here in Ireland, we have flattened the curve very successfully. There was one death yesterday confirmed, maybe 28 new cases in that region, and that has been the pattern for the last week and a half. We had one day without any deaths. And as Hoda mentioned, that has been down to a massive community effort around social distancing, around lockdown of our economy, and testing and tracing throughout the country. So that has been quite successful. However, I would agree with Christian that the EU generally was very slow to demonstrate the kind of solidarity that should be, of course, the hallmark of the EU and the way it interacts with each other, particularly in a crisis. Many people have said, well, made an excuse because public health is not an EU competence, and it in fact falls to member states to deal with public health, and that is absolutely true. However, as weeks went on, the EU was able to demonstrate the kind of cooperation that helped to those countries that were worst affected. For example, the sharing of PPE, for example, procurement of medical equipment and medicines, and also taking patients into a place like Germany from those countries that were worst hit. So I think that was very positive. Right now, there are, I think, one critical response by the European Union that has been successful, and that is the response of the European Central Bank. And that has ensured that sovereign debt has not got out of control, that countries like Ireland are able to borrow on the markets. Our own Treasury Management Agency raised 6 billion a few weeks ago at a very low interest rate, and that is happening throughout Europe. But as Christian mentioned, a lot of countries have entered this crisis with a very high level of national debt, including Italy at 135%. So that's a critical intervention. The second critical intervention will be the way in which we continue to support employment until such time as some degree of normality returns to the economy. And we can't support every SME because we don't know if all of them are sustainable. We know that the economy structure has changed. We know that demand has changed. So we don't know if companies that were sustainable in February are going to be sustainable in September and into next year. So the best way to support businesses is to support wages. Businesses will take employees back. And if we support at that level, I think that's the best way. And I think it's the key message I'd like to convey to other member states and to GCC states, that if you continue to support SMEs to employ people, they will take people on if the demand is there, and it will be a good way of screening those companies that are capable of recovering and developing resilience post-COVID. The third major change in Europe, of course, is the Franco-German initiative that has emerged in the last couple of weeks and will be socialized with the European Council on the 18th and 19th of June. And that is a massive step forward, described by the German finance minister as reminiscent of what Alexander Hamilton did in the US in 1790, albeit legacy debt was mutualized in 1790. That's not the case here. However, it is a major step and represents a really fresh thinking, particularly in the German government. And as we know, the European Union has evolved over many crises, taking on additional powers, sometimes at institutional level. Sometimes they are outside the EU and they're intergovernmental in nature. But I think that this is one of the key ways in which the EU has evolved. But it has to be careful not to go too fast. Many people compare it to a slow bicycle race, in that if you go too fast, you lose. If you stop, you fall over. So slow and incremental additional powers are the characteristic of EU evolution, and we're seeing it live right now in response to the COVID emergency, although it hasn't yet been agreed, this proposal by the European Council. And I think the final thing about EU I would like to say is around that public health competence. I think one of the things that will emerge on the EU side is the capacity of the EU to develop public procurement around medicines, to develop medical reserve, perhaps to diversify its medical supply chain. So the final thing I want to talk about then is how all of this is impacting on EU trade, because I'm on the EU Trade Committee, and Thierry Breton said at the beginning of the crisis that perhaps globalization had gone too far, and the EU is now talking about open strategic autonomy to underline the fact that there will be diversification of supply chains, not reshoring probably, but this will change the nature of international trade. Perhaps the ambitious free trade agenda that was there in terms of new free trade agreements has been delayed, and it's a big issue for GCC, of course. Conscious of time, John, one last issue I want to touch on. Thanks, John. Is something that Hoda mentioned, which is around the area of development and humanitarian assistance. I think Christian mentioned it too. And post-Ebola, one of the promises that was made by every government that had contributed financially, including the Gulf states and Red Crescent and Islamic State and various, or Islamic State, I beg your pardon, Islamic Relief. If I could take that back, but there you go. Islamic Relief made such fantastic contributions to the response to Ebola back in 2014. And health system strengthening is the development response that we're going to be looking for in the future. We still don't know how this is all going to impact in developing countries, who are impacted not just by the health crisis, but also secondary impacts on livelihoods and food security and drops in commodity prices. And indeed in oil prices that have been affected. So I think that's the one area where EU-GCC cooperation, I hope, in the future will really deepen and strengthen to all our benefits and to the planet. So John, I'll leave it at that, and I hope that's not strayed too far over my time.
No, indeed. Thank you very much indeed. We have about 15 minutes left, and I already have some questions. So I'll put a few. I'll put them as we go along. In fact, I can start with you, Barry, as you have the floor, as it were, and then I'll move to maybe Hoda and Christian. How confident, Barry, are you that, or how confident can we all be about economic recovery and Europe's ability, for example, to rebound from COVID, or are there very troubled waters ahead in its wake?
I think there are troubled waters ahead, but I think there are certain positive things that have happened, John, on the European scene, particularly, for example, Euroscepticism has strangely reduced during the course of this crisis. It's possibly because in an emergency like this, expertise is relied upon, and the sort of sloganeering you get from populists has been less attractive. And in the background of all of this, John, of course, is Brexit, which has also turned the face of many Eurosceptics away from leaving the European Union to reforming the European Union. So structurally, I think the European Union is going to be a little bit stronger after all of this. And I think the Franco-German initiative that I've described and the ECB's doing everything that is required will also help. And I think the public health competence, if it is acquired by the European Union and granted by the member states, I think that will particularly strengthen. In terms of the economy, I'm afraid I amn't as optimistic. I'm very concerned about a second surge in Europe. I think the release of the lockdown has been too rapid. I think the anxiety to recover the tourist season has been very understandable, but I'm very concerned about how that's actually going to impact in terms of international travel, on tourism and hospitality. So I'm very worried about the economy, but it's just so uncertain right now, John. I couldn't really, I'd be slow to make too great a prediction.
And you've left your crystal ball in Brussels. So.
Definitely, it's an occupational hazard.
It is indeed, and it's very difficult to be certain about anything at the moment, because indeed, as you've said, as Hoda said also, you know, we're feeling our way. We're not too sure. How will this go? How will it develop? Where will we go from here? Hoda, just to move from Barry to you, and you looking from Riyadh at what was going on in Europe. Can you describe, for example, how the EU response, in your view, to the coronavirus crisis is seen by people living in the Gulf countries? Now, I'm not saying you speak for everybody in the Gulf countries, but just your personal reaction.
Well, like I said before, I think the fact that the pandemic affected Europe before most of the Gulf states, with the exception of Iran, obviously, I think it was a good learning lesson for us to see how the European countries were going to deal with this. I think it's really unfair to criticize the way Europe and European governments dealt with the pandemic, because like we mentioned, nothing was foreseen. Nothing could have even told us which direction this was going to take or how large it was going to happen. A lot of people did say at the very beginning, Europe is not taking necessary measures. Europe was taking it lightly. Yes, but as you all have very well mentioned, I think that throughout the pandemic, lessons were learned, measures were taken. Perhaps, yes, if Europe had taken measures earlier, the numbers would have been a lot lower. But they had nothing to work on to see as an example as we had. So it was very easy for us to say, this is what happened to Italy, this is what happened to the UK, let's not go down that road and let's take the measures early on. And this is what we did. So I think it's a bit unfair to criticize Europe.
Sure. I'm going to ask you one other question. When I met you last June, we had one of our conversations was around education, the education of our young people. As you know, children's education across the world has been severely disrupted, resulting from the arrival of COVID. Do we now need to rethink how we deliver education into the future? Just a quick response to that.
I think we do. I think that this has also taught us the use of technology, working from distance. I think that children will miss out on the social development skills that they can get by being in a classroom, etc., but they will gain on other levels. It's going to be a very interesting road for the educational field. I think we really need to rethink the way we do things.
Great, thank you very much. Christian, there is a view, and I think we've discussed it indeed, that this coronavirus could lead to a new migration crisis, as the pandemic probably is likely to bring about significant geopolitical shifts in many regions, including the Middle East and North Africa. Would you care to maybe say a few words on that, please? I think we've lost your mic. You may have switched off the microphone. You have it. It's back.
I was unmuted, yes.
Yeah.
Well, I mean, we've seen a massive increase in refugees and in migration flows already over the past decade. Now, in that context, yes, this pandemic is certainly going to impact a little bit on, the path forward on globalization, but it will not completely change. It will not stop globalization completely. And we're going to likely to still see large-scale migratory flows. And that's something that also all the governments, both in the Gulf and in Europe, are going to have to cope. Europe experienced its migration crisis in 2015, 2016, also largely due to some of the unresolved conflicts in the Middle East. Now, Syria is still a raging conflict. We don't have so far a solution to the Syrian crisis. And as we saw even at the very outset of COVID, the difficult relations that still exist with Turkey have once again exposed the possibility of further migration flows coming out of these conflict zones towards Europe. So again, these are going to be issues that are going to continue to accompany us as we move along. And that's still, I think, specifically on the migration question, Europe still has to do quite a lot of work in order to form stronger solidarity within on how to tackle some of these crises and make sure that Europe doesn't just respond by further strengthening borders or securitizing this issue. I think it's important to maintain a sort of humanitarian approach also to many of these refugee issues.
Thank you very much, Christian. Barry, if I can come back to you for a minute, it's probably a little bit early yet to establish in a way what we've learned, or to agree on what we've learned from COVID. But I would say, just maybe, could you have a stab at what fundamental lessons have we learned from the COVID pandemic that will help us in the future, with maybe the future kinds of pandemic that you've hinted at when you drew with the reference to Ebola and to other issues there when you spoke?
Yeah, John, I think that I would agree with Christian that we're probably overstating the end of globalization, and I think that diversification argument is over reshoring is really where I see the debate landing, and it's going to be in particular sectors, particularly in the area of medicines. I think one thing we've really learned, I'm absolutely astounded by, is the incredible commitment of healthcare workers throughout the world, and many of them, by the way, touching on Christian's last point about migrant workers. who work certainly in Ireland. We have people from the Philippines. We have people, we have Irish health workers working in the Gulf. It's just one of those services that is that people provide across borders all over the world, and they're putting themselves in harm's way to protect the public has been just underlined again. Anybody who worked on the Ebola outbreak in West Africa in 2014 would have seen that as well, where there was a massive international response. I think in this instance as well, one of the lessons that I'm a little bit concerned about is that there isn't a massive deployment of human resources or financial resources to the developing world that in the way that they're impacted, not just in the health crisis, but also in the secondary impacts that I've mentioned before. So there's going to have to be a rethinking of the way that we support developing countries get through this crisis. So for example, where we have development funding, it should be easily adaptable to humanitarian funding. When we deal with vaccines, when they come, John, the vaccine nationalism that we've seen demonstrated by some governments, which I won't mention right now, that has to be put to an end. There is elements within the World Trade Organization that allows for flexibilities on the use of vaccines by developing countries, and that needs to be encouraged too. So they're kind of things that I'm worried a little bit about downstream, but on the positive side, we have seen incredible innovation, John, in relation to the digital economy, about e-commerce, even in education, as Hoda's just mentioned, that are ways of working for the future. But we can't lose that social interaction, particularly of our children.
Thank you very much. And just leading on from that, a question that when we spoke on the phone, I raised with you, Hoda, and you had a particular view that, you know, this is a question I've asked somebody else in another forum, that as the world continues to battle the devastating effects of COVID, we've seen the hundreds of examples of great courage, the kind of people that Barry described, you know, great courage, heroism, and indeed community solidarity, great courage, people in their own homes and how they handle this situation. Will these, in my view, will these extraordinary examples help to make us, all of us, more tolerant, more caring, and maybe turn us into better people in the future? I know it's a very mixed bag, as we've discussed. So,
I'm a very positive, you know, hope in humanity kind of person, and my positive self will say yes, definitely, as seen by all the another example to the examples that Barry has mentioned, which includes a lot of Saudi student doctors in Britain and in France and in the US, all helping out, refusing to come back so that they can be with the front line, working towards helping others with the corona. So I would love to say yes. However, my more realistic self will say something that, you know, is probably very negative. I don't particularly think so. And I think that what is happening in the United States today is an example of how this can really get out of hand. So I think it's a question of wait and see. I think human nature in itself is intolerant, is selfish, is racist, is negative. And if it weren't for all the guidelines, for the rules and regulation, for faith and religions, I don't think that, you know, we'd be any different from a lot of, you know, animals out there, basically. So unfortunately, I don't think so.
Okay, thank you very much indeed. Now, having promised that I would begin on time and end on time, we've come to an end. I am so grateful. We had a very stimulating, interesting, wide-ranging discussion, coming at it from different perspectives, and indeed sharing our own personal thoughts and our insights and perceptions and reflections. We could keep on, I'd say, for the next hour, because there are lots and lots and lots of questions that we have on hand and that are coming in. But maybe we'll come back to this at a future date. We're planning other webinars that will lead from or will touch on different aspects of COVID. I am hugely grateful to Hoda and to Barry, both of whom said yes instantly when I called them. And I am hugely, hugely grateful to you for your support and for your for the preparation that you did for this and for your fantastic contributions. Very grateful to Christian, who works with me very closely every day of the week, and whose contribution to this, of course, is also enormous, and indeed to the work of Bussola. And I also want to thank very specially our invitees, those who have been listening in to today's. The number is very large for a webinar of this kind, and we just thank each and every one of you, and we'll now allow you to go back to your other tasks and your other jobs and your other duties. And thank you all very, very much. We look forward to seeing you all in the near future again. Thanks a lot.
Thank you, John. Thank you.
very
Thank
much.
you,
It was
John.
very
Nice to
enjoyable.
meet you all. Thank
Yes,
you.
very nice to meet you.